I'm Dr. Hasrin.
I'm Dr. Sarah.
Welcome to Dr. Tooth Dental Talk.
Today, Dr. Hasrin and I are going to talk about braces, in a series of episodes to answer all your questions because we know a lot of you are curious about it.
So, normally when patients come in for braces, their biggest concern is pain.
Yes.
Right?
Yes.
Yeah, so they normally ask if, let's say, is it painful or is it going to hurt me or anything like that. But actually, to be honest, when we place the braces, the brackets on, actually, you don't feel any pain. The pain only actually kicks in about 6 hours later, and you won't even feel like a toothache kind of pain. It's more like a pressure kind of pain.
Yes.
Yeah.
I also think that patients kind of need to understand that there's no such thing as like completely pain-free dental treatment.
Yeah.
Yeah, because it doesn't matter whether it's braces, it's fillings, or sometimes even after you do a simple scaling, it comes with some amount of discomfort. Okay, and that is to be expected even when you wear braces. Although of course our job is to minimize the pain for you, I think you still need to expect some of it.
Yeah. And also, beauty is pain.
Correct. So over here, when we get braces patients, usually the first step is we start with consultation first, just regular consultation to get to know what our patients are most concerned about.
Yeah.
Okay, because at the end of the day, that is going to be our goal and how we plan our treatment around that goal. Okay, and afterwards, what we do is we have to take a number of records. Okay, so for example, things like x-rays, usually we take 2 x-rays, some pictures, and we also take what we call a mold or impression. Okay, so the purpose of all these records is because we would like to study those cases, and it's actually a lot of effort.
And homework.
Okay, yeah, it's a lot of homework. We actually take those pictures, those models, and all these things, and we really study them in detail before we can decide like what is the best for you.
treatment.
Yeah. And once we're done coming up with the proper treatment plan, what we do is we'll recall you back, and we'll usually discuss with you first, because we don't really want to force it upon you also. Okay, we always want to make sure that our patients are more comfortable.
True.
Okay, and only once you agree with our plan, then it's when we're going to proceed. Okay, so usually once we proceed, what we'll do is we'll start placing the braces or the brackets. We call it the metal brackets on your teeth. Yeah. And okay.
Yeah, unless you have like maybe extractions or something, then you have to do your extractions first, then you place the brackets on. Yeah. So basically that is the 3 main steps, and after that you come in for your monthly reviews. Depends on your case, probably about 18 months to 24 months. Yeah, depends on how is your teeth condition.
Yeah, everybody's teeth moves differently.
Yeah.
It's really a case by case basis. Yeah, at the end of the day.
The next part is actually about the pricing. That's another biggest
The
concern.
most important thing.
Yeah, most important. A lot of patients come in, they don't really ask anything much actually, other than pain. They'll ask second one is price. How much is it? So basically, it starts at about 5,000 and can go up to about 8,000. This depends on the type of braces. So we have like the conventional or the self-ligating braces, or if let's say your teeth is simple, then it will be much cheaper. And if let's say it requires like a specialist management, when your teeth is a bit more difficult to move, or we expect some complexity in your case, then you'll be referred to a orthodontist. You'll be under them. So of course with the orthodontist, then you can expect a bit more expensive. Yeah.
And then even like some patients, sometimes they need like additional accessories.
Yeah, true.
Yeah, so things like placing bone screws, we call those tats. Yeah, if they need those things also, usually we'll disclose it to you beforehand, or even sometimes they need appliances before we put on the braces itself. So all these things will be discussed with you before we place the brackets on.
It's not you pay it in all one shot. Of course there's like a few steps lah.
Yes.
So basically when you take your records, there's a bit you have to pay, and then it goes on with consult. So you sum it all up, that's the figure we'll give you. Let's say your reviews, you come every month, is also included in the pricing. Yeah. Okay, so that's all for episode 1. See y'all in the next episode of Dr. Tooth Dental Talk.
Hope we weren't too boring.
Hope so. Thanks
See
for your
ya.
time.
Bye.